If you're one of the 537 million people living with diabetes worldwide, you've probably experienced dental problems that seem impossible to fix. But what if I told you that the groundbreaking tooth regeneration therapy coming out of Japan might work differently for diabetics? And that's not necessarily bad news. Today, we're diving deep into whether diabetics can benefit from tooth regrowth medicine. And the answer might surprise you. Welcome back to Medical Miracle, where we bring you the latest breakthroughs in regenerative medicine. I'm your host, and today we're retackling one of the most requested topics from our community, the intersection of diabetes and tooth regeneration therapy. If you're new here, make sure to subscribe and hit that notification bell, because we're recovering the Japanese tooth regrowth drug trials every single week, with exclusive updates you won't find anywhere else. Now, let's get into it. First, we need to understand why diabetics face unique dental challenges. If you have diabetes, you're twice as likely to develop gum disease compared to non-diabetics. High blood sugar levels create the perfect environment for bacteria to thrive in your mouth. This leads to inflammation, gum disease, and ultimately, tooth loss. But here's the vicious cycle. Severe gum disease can actually make it harder to control your blood sugar. It's a two-way street that affects over 22% of diabetics who end up losing teeth. Traditional dental implants. They have a higher failure rate in diabetics because of slower healing, increased infection risk, poor bone integration, compromised blood flow. So when Japan announced their tooth regeneration drug, diabetics around the world asked the same question: will this work for me? Let's quickly recap what we're talking about. The Japanese tooth regrowth medicine, led by Dr. Katsu Takahashi at Kyoto University, works by targeting a protein called USAG1. This protein normally prevents our teeth from growing beyond our childhood set. The drug blocks USAG1, essentially unlocking the body's natural ability to grow new teeth. Phase 1 trials completed in 2024 showed remarkable safety profiles. Phase 2 trials are currently underway with human participants, and early whispers from the research community are extremely promising. But here's where it gets interesting for diabetics. Now for the big question: can diabetics safely use tooth regeneration therapy? Based on the current research data and consultation with dental regeneration experts, here's what we know. The good news: number one, the USAG1 inhibitor works at a molecular level that is not directly affected by blood sugar levels. Unlike bone grafts or traditional implants, this therapy doesn't rely on perfect healing conditions. Number two, early animal studies included diabetic mice, and the tooth regeneration still occurred. The process was successful even with elevated glucose levels. Number three, the drug targets tooth bud activation, not bone regeneration. This is crucial because diabetics struggle with bone healing, but tooth buds are different biological structures. The considerations: first, if you have uncontrolled diabetes with HbA1c levels above 9%, you'll likely need to stabilize your blood sugar before being eligible for treatment. This is standard for any dental procedure. Second, diabetics with severe periodontal disease may need gum therapy first. You need healthy gum tissue to support new teeth, regenerated or not. Third, the success rate might be slightly lower compared to non-diabetics, but early indicators suggest it's still significantly higher than traditional dental implants for diabetics. So here's your action plan. If you're diabetic and interested in tooth regeneration therapy, step 1, optimize your blood sugar control. Work with your endocrinologist to get your HbA1c below 7%. This will make you an ideal candidate once the therapy becomes available. Step 2, prioritize your oral health now. Brush twice daily, floss religiously, and see your dentist every 3 to 4 months instead of twice a year. Healthy gums are essential for any future tooth regeneration. Step 3, document your dental history. Keep detailed records of tooth loss, x-rays, and treatments. When tooth regeneration therapy launches commercially, potentially in 2027 or 2028, this documentation will help determine your eligibility. Step 4, stay connected. The Phase 2 trials are expanding. Some research centers may be looking for diabetic participants specifically to study the subset. Check clinicaltrials.gov and follow updates on channels like ours. Here's the beautiful truth: tooth regeneration therapy might actually be better for diabetics than current options. Why? Because it works with your body's natural systems, rather than forcing foreign objects into compromised bone tissue. It's regenerative medicine at its finest. Dr. Takahashi's team has specifically stated they want this therapy accessible to people who currently benefit from dental implants. That includes diabetics, people with autoimmune conditions, and elderly patients with fragile bone structure. The Japanese approach to medical innovation has always been inclusive, and early signs suggest they're designing this therapy with real-world patients in mind, not just perfect clinical specimens. If you're diabetic and watching this, don't lose hope. The future of dental regeneration is being designed with you in mind. Drop a comment below telling me, are you diabetic? Would you try tooth regeneration therapy when it becomes available? I read every single comment, and your stories help shape future videos. If you found this information valuable, smash that like button and subscribe to Medical Miracle. We're tracking the Japanese tooth regrowth trials closer than anyone else on YouTube, and you'll get updates the moment new information drops. Check out these videos next to learn more about tooth regeneration therapy and how you can prepare your body for this revolutionary treatment. Until next time, stay healthy, stay hopeful, and remember, medical miracles are happening right now.